Hi, welcome to Jenny Ferguson's Pilates session. Before you start, please make sure you've got plenty of space to move around in and everything is safe in your environment. Please make sure you've got some cushions, maybe a band, maybe a spiky ball or a tennis ball, just in case you need them for the session. Please stop if anything causes you any pain or discomfort and seek medical expert advice if this does happen. If you're really just not sure on an exercise, please stop and seek some advice next time you are in the studio, or whiz us a quick email and we will check in with you. I hope you enjoy the session. Hi, Jenny here from Jenny Ferguson Pilates. I've just got 4 exercises to help anybody with if they're having lower back issues, sacroiliac joint issues, sciatic pain, or pain down the backs and the fronts of your legs. These 4 exercises are really good and beneficial to be doing. So I'm going to go through them. Please stop if anything causes any increased pain or discomfort. Whiz me a quick email at info@Sheffield Pilates, and we'll give you some advice on maybe which ones to avoid or where we need to be looking at. Or please, if you are having any issues at the moment, please seek some advice from a health professional, or if you're seeing anybody for treatment or previously were, please ask their advice on these 4 exercises. So the first one we're going to do is laying down on your back, and it's called the hip roll. Some of you might be familiar with it, but I'm going to talk you through it. So if we come down to lay onto your back, we're going to pop your head onto the cushion if you need a cushion. If your head is out of alignment, so without the cushion, if you feel like your chin's poking up and you are struggling to get your head to nod the chin and lengthen the back of the neck, I would go with a cushion underneath your head. You're going to glue the legs tight together, and you're going to pop your arms out just below shoulder height with your palms up. If you have any hip or knee issues, you might want to pop a towel or a cushion between your legs. So I'd like you to breathe in. And as you breathe out, you're going to be aware of that support in the center of the body. So think about the abdominal muscle pulling in a little bit. Now imagine your knees are at 12 o'clock at the moment. And as you now breathe out, you're going to let your knees go from 12 o'clock to 5 past 10 past. And you're going to rotate through the waist. So you're going to lengthen through the back of the neck. Hold it there. Stack the knees, stack your feet, and feel your hips stacking. Be aware of that abdominal area working to help support the back. Inhale. And as you exhale, peel the body back. So bring the pelvis back, bring the legs back, relax the shoulders, and keep your chin nodding. Inhale. And as you exhale, take your legs across from 12 o'clock to 5-2, 10-2. Ease into it. Please do not force this. Now feel your lengthening through your lower back. You're trying to encourage the coccyx to lengthen away from you. Definitely don't let the back arch. So feel length through the body. Keep the knees stacked, keep the thighs stacked, keep your feet stacked. Inhale. And as you exhale, draw the rib cage in and down and come all the way back into the center. Inhale. As you exhale, shoulders are nice and relaxed, palms up, rotate. So really think about rotating from the waist, and the lower body is doing the movement. Lengthen the spine, glue the legs tight together. Inhale. And as you exhale, roll back to the center, using your core to come back. So relax the shoulders, nod your chin, and keep the legs glued tight together. Inhale. As you exhale, take your legs to the left from 12 o'clock to 5-2, 10-2. Keep the shoulders relaxed. Rotate through the waist. Feet stacked, knees stacked, thighs long. Hold it there. Little bit of a pelvic tilt, so feel your lengthening through the lower back. Inhale, and as you exhale, use the core to come back to the middle. Do not pull from your back. That's where the issue is. So strengthen and use your obliques and your core to rotate the body back into the center. Give me 2 more there. So breathing in, and as you breathe out, rotate through the body, softening the rib cage. So bring the ribs down, but bring the hips across. Relax the shoulders Open up the spine, but feel length through the lower back. Inhale. And as you exhale, use your body and the core and the center to bring the body back, the legs back to the middle, rather than your shoulders and your neck. One more time. Inhale, and as you exhale, take your legs across, 5-2, 10-2. Some of you might be getting a bit further now, which is fine, but just work at your own pace. Do not go too speedy. That's when your body goes into a little panic and the muscles will contract and tighten, and the ones you're trying to open up won't let your movement happen. Inhale, lengthen the waist, and as you exhale, use the center of the body to come back into the middle. So you could always do a couple more there. I'll probably do between 6 to 10 repetitions, depending on how your back is feeling and your legs. Your next exercise is a knee hug. So you're going to bring your right knee in towards your chest and feel the lower back drawing down. As long as you haven't got any neck issues, or anything that you shouldn't be doing, lifting your head and shoulders up. So abdominal hernia, please keep your head and shoulders down. If you do not have any of those issues that's going to cause an irritation, bring your head up and stretch out there. Hold for a few seconds and then lower back down. Bring the left knee in towards your chest. Hold it there, let the back soften. So taking some deep breaths here will really help. Again, if it's okay for you to be doing so, if you're not sure, keep your head and shoulders down. But if you can and it's okay for you to do so, bring your head up. Now make sure you're not lifting your bottom up, so you're definitely keeping the pelvis and the buttocks down towards the mat, and you're not wandering across with your knee or out. Are you nice and central in the movement? Is it balanced, your movement? Try not to squeeze your buttocks, so let go of your buttocks and this right thigh, and then roll back down and pop your foot down. Give me 2 more. So bringing the right knee in and hold it there, encouraging the back to draw down to the mat. Don't force it, but try and soften the back muscles. Relax your left leg, and then if it's okay for you to do so, come up and hold. And again, are you wandering off to the right or the left? Do you look pretty level? Is your pelvis, the back of your pelvis staying down? If you're not okay with your head and shoulders, if it tightens into your neck, pop your head down and then let it release, and coming in with the left leg, curling up if that's okay for you to do so. Excuse me. Holding it there. Breathe. If it's not okay on your neck, keep your head down but your knee tucked in. And then let yourself release. Have a little release off there. If it's okay on your back, straighten the legs out one at a time, or both legs at the same time, if that's okay. You might also feel like you just want to release off your neck there as well. So we've got one more exercise here. We're going to stretch into the glute and your piriformis muscle, which is often a culprit of causing any leg pain. Not always, but often can be the culprit. So I would like you to get your pelvis level. Your feet are now apart and parallel position. Your thighs are parallel and your knees are pointing straight up towards the ceiling. Okay, it's really important on this exercise that you don't let your hips tip or rock. So now your pelvis is going to stay nice and level. We're going to bring your left foot and ankle and cross it over your left leg. So you've now got a gap between your legs. So it's like you're crossing your legs, but you've not got your legs together. You've got a gap between your legs. Holding it there for a stretch. I'd like you to pop your left hand onto your left hip and try and make sure that your left buttock is on the mat. The left side of the pelvis is on the mat. Your right hand is then just going to apply a little bit of resistance there to open up that hip and glute area. So holding it there. I'm just going to change my position a little bit just so you can see what my legs are doing a little bit easier. So from here, you're keeping the weight in the left side and your right hand and leg is coming on to that position, onto that right leg to ease it out and away. Really important that you're not letting it rock there, because that's going to really change your back position. You definitely need the left side down and the right leg driving away from you, holding it there. Again, you just need to hold for about 20 to 30 seconds. Nod your chin. Are you tipping your head back now? Holding it there. A few more seconds. And then easing off. Pop your right foot back down and onto the mat. Have a little settle. Try and make sure you're in the middle of your mat and your spine feels nice and long. Right hand onto your right side of your pelvis, onto your hip bone. Left foot and ankle's going to cross over and make that number 4 position. You've got with your legs, you've got a gap between your legs. Definitely don't let your right hip pop up. Keep the right hip down. Left hand onto your left leg and drive the left leg away. Again, if I just change my position, just so you can check your leg alignment, make sure you're not rocking over to that left side, that your right side of the body is definitely on the mat. You're nodding your chin and lengthening the back of your neck, and your left hand is pressing away. So kind of feel like a little bit of an opposite feeling through your hands, through the body. So your left hand is not super hard pressing away, but it's easing that left leg away from you. But as you do that, you're feeling the right side of the body pulling away and drawing down and into the mat. Yeah, holding there, nodding your chin, keep breathing. Definitely don't hold your breath. Holding it there. Couple of deep breaths. And then let it release and pop your legs down. Again, if you want to come up into that little stretch, bringing your knee in for a knee hug, do so. If you feel like you need to stretch your legs out, do so. We've just got one more exercise that feels beneficial. Obviously, it's entirely how it feels for you as well, and what feels good to be moving or not. Remember, there's sometimes you can feel some discomfort, but it's like a good discomfort because it's getting a stretch and a move. So we're going to roll over onto our front. What I would do, if you are quite arched in your lower back, or if it's uncomfortable on the pubic bone, hip bones, pop a cushion underneath your tum. Yeah, if you feel you need to. Yeah, so some of us, it might feel better there. You might also want a cushion for your forehead as well, depending on alignment of your neck and shoulders. Legs are relaxed and apart. Switch off through the buttocks and the legs. You're going to pop your forehead onto your cushion and your arms are into like a W position, quite close and tucked into the body. Now switch off the legs and the buttocks. Inhale. As you exhale, slide the shoulders away from your ears. Keep your forearms and your elbows and your hands on the mat, and then press yourselves up. So you feel like you're trying to elongate and lengthen the upper back, but you're not squeezing into your lower back. So I don't want you to think about bending your back. I want you to feel like you're trying to lengthen the back. Switch off your buttocks and legs, and then lower and come down. Breathing in, and as you breathe out, engage into the core, slide the shoulders down, and you're coming into that lengthening of the back. Feel the crown of your head drawing away from the waist. Try not to let your head lift. Keep your chin tucking in, and try and feel that you're creating some space through the spine. Definitely support yourself through your shoulders and your arms, and then lower and come down. If it is pulling tight here across your lower back, please come a bit slower and a bit smaller. Do not come up as high. So ease into that and work up to the height. So inhale, and as you exhale, slide the shoulders down and lengthen. You might only get here. It might just be a little lengthen. Abdominal muscles pulling in. So feel the belly button pulling away from the mat. Switch off your buttocks and legs and have a little release and down. Give me one more there. Inhale. As you exhale, slide the shoulders down. Engage into that abdominal area. Feel the belly button pulling in. Just be aware of that support through pelvic floor muscle. Lengthen. Some of you might come a bit higher as long as it feels okay on your lower back. And then lower and come down. At any point, let your head turn, release the neck, stretch your arms out. So to come out of this position, I'd probably roll onto my side and push yourselves up. Just be mindful as you're moving. Hopefully those exercises are going to be beneficial for you. Do as much, as little, or as much as is good for you. Please build up those exercises. So if something feels uncomfortable, and you know that you shouldn't be doing any more repetitions, please do not. Build up to doing 8 to 10 of those repetitions of those exercises. Please stop. Remember to stop if anything causes you any pain or discomfort, and seek some advice. I hope to see you online soon. So thanks for joining in this session. I hope you enjoyed it, and please be in touch if you do have any questions. Send us an email, and I hope to see you online soon.